Hello and welcome to the VetHelp channel. I'm glad you're joining us today for a very important topic, Canine Distemper Virus. This is, without a doubt, one of the most serious and dangerous viral diseases that can affect our dogs. It's a multi-systemic disease, meaning it attacks the respiratory, gastrointestinal, and even the nervous systems of our beloved companions. It's a tough subject, but understanding it is the first step toward protecting our pets. So please stay with us as we break down what this virus is, how to spot it, and most importantly, how to prevent and manage this potentially deadly infection. So what exactly is Canine Distemper Virus? Often abbreviated as CDV, it's a highly contagious disease caused by a specific type of virus called a morbillivirus, which belongs to a larger family known as Paramyxoviridae. If that sounds a bit scientific, think of it this way. It's in the same family as the virus that causes measles in humans. While it doesn't infect people, it's incredibly effective at spreading among canines. It primarily affects our domestic dogs, but it's not exclusive to them. This tough virus can also infect a wide range of wild carnivores. We're talking about animals like foxes, wolves, coyotes, raccoons, and even ferrets. This is important to remember because it means the virus can be present in the environment even if there aren't any sick domestic dogs nearby. The wide range of hosts makes it a persistent threat in many ecosystems. Now, let's talk about how this virus gets around, which is key to understanding prevention. The Canine Distemper Virus is an expert at spreading from one animal to another. The primary method of transmission is through the air. When an infected dog coughs or sneezes, it releases tiny virus-filled aerosol droplets into the environment. If a healthy dog breathes in these droplets, they can become infected. It also spreads through direct contact with bodily fluids. This includes nasal discharge, eye discharge, and even urine. Beyond direct contact, the virus can survive for a short time on surfaces. Things like shared food and water bowls, bedding, or toys can become contaminated. If a healthy dog comes into contact with these contaminated items, they can pick up the virus. Once the virus enters a dog's body, it gets to work quickly. Its first stop is usually the lymphatic tissue in the respiratory tract. Think of the tonsils and lymph nodes in the throat area. Here, it begins to multiply rapidly. This initial replication phase leads to what we call viremia, which is just a term for the virus entering the bloodstream. Once it's in the blood, it's like having a highway pass to the entire body. From the bloodstream, the virus launches a full-scale invasion, targeting multiple organ systems. It sets up shop in the respiratory tract, causing coughing and pneumonia. It invades the digestive system, leading to vomiting and diarrhea. And perhaps most devastatingly, it attacks the central nervous system, the brain and spinal cord, which leads to the severe neurological signs we'll discuss next. The clinical signs of distemper can be heartbreaking to witness, and they often change as the disease progresses. It's crucial to recognize the signs early. In the initial stage, you might notice your dog has a high fever, sometimes spiking and then falling. They might seem lethargic or depressed, not their usual playful self. A clear discharge from the eyes and nose is also a classic early sign, which can later become thick, yellow, or green due to secondary bacterial infections. A dry cough often develops as well. As the virus spreads to the gastrointestinal tract, the symptoms worsen. You'll likely see persistent vomiting and diarrhea. This can lead to severe dehydration and a significant loss of appetite, causing your dog to lose weight and become progressively weaker. The combination of respiratory and GI signs really takes a toll on the dog's body. The most severe and often final stage involves the nervous system. This is when the virus attacks the brain, and the signs can be dramatic and varied. You might see involuntary muscle twitching, often called chewing gum fits, when it affects the jaw. Some dogs develop seizures, which can range from mild to severe. Other neurological signs include a head tilt, circling, or stumbling as if they're drunk. In the worst cases, paralysis can occur, often starting in the hind legs. Another unique and telling sign of distemper is something called hard pad disease. In some chronic cases, the skin on the dog's nose and the pads of its paws become sickened and hardened. It's a painful condition and is a strong indicator of a distemper infection. So, if you see these signs, how does a veterinarian confirm a diagnosis of canine distemper? a vet will start by looking at the combination of clinical signs, especially if they involve the respiratory, GI, and nervous systems. Your dog's vaccination history is also a critical piece of the puzzle. An unvaccinated or incompletely vaccinated dog showing these symptoms is immediately a high suspicion case. But to be certain, laboratory testing is required. One of the most reliable diagnostic tools is a test called RT-PCR, which stands for Reverse Transcription Polymerase Chain Reaction. This high-tech test can detect the virus's genetic material, its RNA, from swabs taken from the eyes, nose, or throat. It's very sensitive and specific. Another method is immunofluorescent antibody testing. This involves taking a sample of cells, perhaps from the conjunctiva of the eye, and using special fluorescent antibodies to see if the virus is present in those cells. A simple blood test or hematology can also provide clues. A common finding in distemper cases is lymphopenia, which is a significantly low number of a type of white blood cell called lymphocytes. This indicates the immune system is under attack. Now we come to the most difficult part of dealing with distemper: treatment. It is crucial to understand that there is currently no specific antiviral drug that can kill the canine distemper virus once a dog is infected. There's no magic bullet. Therefore, treatment is all about supportive care. The goal is to support the dog's body and help its own immune system fight the virus, while also managing the symptoms and preventing complications. The first priority is usually fluid and electrolyte therapy. Dogs with vomiting and diarrhea become dehydrated very quickly. Veterinarians will administer intravenous fluids, like Ringer's lactate or normal saline, to rehydrate the dog and correct electrolyte imbalances. The dosage is carefully calculated based on the dog's weight and level of dehydration, typically around 40 to 60 milliliters per kilogram per day. Because the virus weakens the immune system, dogs with distemper are highly susceptible to secondary bacterial infections. These can cause pneumonia or worsen GI symptoms. To combat this, veterinarians will prescribe broad-spectrum antibiotics. Common choices include amoxicillin clavulanate, ceftriaxone, or enrofloxacin. The choice of antibiotic depends on the dog's age and the specific situation. For example, enrofloxacin is generally avoided in young, growing puppies because it can potentially affect cartilage development. To make the dog more comfortable, we also use medications to control fever and inflammation, like naloxone. If the dog is experiencing neurological signs like seizures, anticonvulsants are essential. Diazepam can be given intravenously or rectally to stop an active seizure, while a drug like phenobarbital may be prescribed for long-term seizure control. For dogs with severe respiratory distress, medications to help them breathe are used. This can include cough suppressants or bronchodilators like theophylline to open up the airways, and mucolytics like bromhexine to help break up thick mucus. Finally, nutritional and immune support are vital. This includes providing easily digestible, high-calorie food to prevent weight loss. Injections of vitamin B complex and vitamin C can help support metabolic processes and bolster the immune system. Some vets may also use immunostimulants like levamisole in an attempt to boost the body's own defense mechanisms, though its effectiveness can vary. The treatment is intensive, often requires hospitalization, and sadly, despite the best efforts, the prognosis can still be poor, especially once neurological signs appear. This brings us to the most important message of this entire video: prevention. Canine distemper virus is a devastating disease, but the good news is that it is almost entirely preventable through vaccination. The vaccine for CDV is considered a core vaccine for all dogs, meaning every single dog should receive it. The vaccination schedule is critical. Puppies should receive their first vaccine at around 6 to 8 weeks of age. After that, they need booster shots every 3 to 4 weeks until they are at least 16 weeks old. This series of boosters is essential to ensure they build a strong and lasting immunity, especially as the immunity they get from their mother's milk wears off. After the puppy series, an adult dog will typically need a booster 1 year later, and then boosters every 1 to 3 years after that, depending on the specific vaccine and your vet's recommendation. Beyond vaccination, good hygiene is your next line of defense. Regularly clean and disinfect your dog's living area, bowls, and toys, especially if you have multiple dogs or bring new dogs into your home. If a dog is ever diagnosed with distemper, strict isolation is mandatory to prevent it from spreading to other susceptible animals. To wrap things up, canine distemper virus remains one of the deadliest infectious diseases our dogs can face. It's a relentless virus that causes immense suffering. But, and this is the key takeaway, it is preventable. Timely and proper vaccination provides excellent protection and is the single most important thing you can do to keep your dog safe from this terrible disease. Please, talk to your veterinarian and ensure your dog's vaccinations are up to date. Thank you so much for watching and for taking the time to learn about this important topic. If you found this video helpful or informative, please give it a thumbs up and share it with other dog owners you know. And don't forget to subscribe to the VetHelp channel for more reliable veterinary information to help you keep your pets happy and healthy. We'll see you in the next video.